So today we want to talk about yeast infections, which is very common among women, and because in the vagina we have normal floras, which include bacteria and some fungi. The most common cause of yeast infections is candidiasis or Candida albicans, which cause candidiasis, and this is because the most common cause is always when the lactobacilli are suppressed, that leads to multiplication of the Candida albicans, which leads to candidiasis, because too much of anything can be poisonous. So what are the causes of yeast infection? Number one, as I said, so antibiotics will end up eliminating lactobacilli, and this will lead to the multiplication of the Candida albicans, because they won't be kept in check. Number two, we have pregnancy. Number three, we have weakened immune system or immunosuppression. Number four, we have we have we have diabetes or uncontrolled diabetes. So how are yeast infection diagnosed in the hospital? We do a pelvic exam, and in which we may take a cervical swab, or we may take a swab to the laboratory and check for the cause, or check for the Candida albicans, or check most commonly for the pH and etc. So, what are the signs and symptoms of yeast infections? Yeast infections, signs and symptoms includes itching in the vaginal area, dysuria or painful micturition or painful urination, or burning urination may also be a sign of yeast infection. We may also have inflammation in the vaginal wall, or in the opening of the vagina, and we may also have the reddening of the vaginal area. If you notice this, it may be a symptom of candidiasis or yeast infection. You also have a whitish or yellowish clumsy discharge. This may also be a clear indication that you are suffering from yeast infection. And once we diagnose and we realize that it's a primary yeast infection, or not severe one, you may be prescribed with some antifungals to help alleviate, which includes clotrimazole, either cream or pessaries. We also have taconazole and other types of antifungal, which within some few days, 1 to 6 days, your yeast infections should be resolved. For more questions, please post them in the comment section.